Actors have been used in some of the scenes in this film. Commissioners and providers have responsibility to ensure that everyone eligible under the Mental Health Act has access to an independent mental health advocate. But research shows that there are some people who make little or no use of IMHAs despite being entitled by law to this service. An IMHA is a statutory advocate introduced in 2009 to help service users understand their rights and get their voice heard. This film explores issues of equality and diversity and ways of improving the take-up of IMHA.
Different groups of people who we know through the research are much less likely to get the IMHA service offered. People from black and minority ethnic communities, people who have different communication, maybe language, just forms of communication. So someone with a disability doesn't communicate in the usual way, and sometimes no communication around capacity. Somebody isn't able to instruct, and younger people, older people, people who have learning difficulties can often miss out on a service.
Let's hear from IMHAs about how they have reached people from different groups.
There'll be a range of vulnerable groups, people from different minority ethnic communities, people with learning difficulties. One young woman loved to play games, and I brought a game in, and that's what we did every week. We've had a couple of rounds of this game, and then she wanted me to go to her CPA. So it's about finding, innovative ways to build trust and develop a relationship.
One client had been in hospital for a long time, 15 years, and from the beginning he was finding it difficult. I sat down and spoke to him about his treatment, and he found it very difficult to engage with the therapists. Throughout the discussion, clear communication, this guy was able to take this on board and what the therapist was saying, and was able to eventually be discharged. He was very happy, very emotional after the journey he'd been along, and he was ultimately able to move back to the community. And I felt at that particular case, the IMHA was very useful.
People may assume that a young Asian lady would want an Asian advocate or a female Asian advocate, when from experience it's often the case that they don't want either, that they may want somebody from outside of their community because they're concerned about issues of confidentiality and possibly other issues as well. So it is very important not to assume. A simple rule to follow is to ask the person what they want and what they need.
Understand what's going on in your immediate community, the demographics of that. That can actually come about through monitoring, so that we know who we're targeting, who's actually getting the services that they require, and that way we can get a better picture of actually what's going on out there. I think we need more independent mental health advocates from a much more diverse background, and I think if in doing so we can then reach a far wider audience of people.
So how can IMHA providers and commissioners improve the take-up of IMHA?
They need to work more closely as partners with other voluntary sector community organisations that do a lot of the outreach and have direct contact with individuals with mental health difficulties.
There is an overrepresentation, particularly of the Caribbean community, but also of certain Asian communities in the system, which then leads to that issue about advocacy being particularly important. One of the things we do know about the most successful services are the ones that actually reach out into communities. It allows them to do several things, one of which is to build up trust within the community. The second is to build up a knowledge base within the community that this service exists. And the third thing is that it actually allows you to break into the word of mouth network.
Creativity is key in all that we do, and we mustn't sort of stick to sort of tried and tested formulas. We need to be ever changing to address the needs of an ever changing community.
It It is important to make sure that everyone eligible can access IMHA. This includes people from black and minority ethnic groups, those whose first language isn't English, people with physical and sensory impairments, as well as people from lesbian, gay, bisexual and transgendered communities. It is also important to consider the younger and older population and people who don't have capacity to make decisions for themselves or properly instruct an advocate. There are lots of ways to reach minority groups, and it's critical these are used because everyone has the right to be heard.